Alright, so we'll start off with now the hyoid bone. This is a U-shaped bone here, and you can see that it's U-shaped here. This is actually an important bone for speech and swallowing. A lot of muscles actually attach to the hyoid bone, like the sternohyoid, the thyrohyoid, the stylohyoid, the mylohyoid, the geniohyoid. They all attach to the hyoid bone. Now, the hyoid bone can be separated into three components. This area right here, which is known as the greater horn, the little small nubule right there, which is known as the lesser horn, and then in between the lesser horns here is the body. Now, you need to know that there is a scientific word for horn, an alternate word, which is cornua, which actually means horn. And certain words use that word or use that prefix to refer to horns or horn-like structures, like the corniculate cartilage, or like what is that? Can't remember what the name of the disorder is now. Great. I know it's cutaneous horns, but there's another scientific name for it, but I can't think of it now, right? Oh well. Okay, so the alternate word for horn is cornua. No, right. Okay, so now we'll continue on with the cervical vertebrae. So there are these three that I'm going to talk about of the cervical vertebrae, and with these you need to know that they're coming from the cervical region within the vertebrae. There's several regions. There's the cervical region, the thoracic, the lumbar, the sacral, and the coccyx. This, of course, is coming from the top part of the vertebrae, and there are 7 cervical vertebrae. The first two actually have specific specialized names for them. The first one is named called basically the atlas, and the second one is, of course, known as the axis. All other cervical vertebrae are just known as cervical vertebrae. So we'll begin with the atlas, which of course is the first cervical vertebrae, and you can see that it's unique because it has kind of an oval shape and it's very flat. Now, the cervical vertebrae sits on top of the second cervical vertebrae, which is very important. We'll come back to that in a second, but it sits underneath the occipital condyles. And so this allows for the head to sit right on top and then pivot, so it kind of like hinges in a sense, and allows for the head to then move in a kind of an up and down, a yes motion. Okay. All cervical vertebrae are very unique because there's a process that sticks out all vertebrae called the transverse process. But what is unique about cervical vertebrae is that all cervical vertebrae have an opening that goes through that transverse process, and because of that, this opening is known as the transverse foramen. And the reason that all cervical vertebrae have that is because there's a particular blood vessel, a series of blood vessels, actually an artery and a vein, that actually go through that, and it's called the vertebral artery and vertebral vein that go through the transverse foramen. Now, on the axis, which is the second cervical vertebrae, which is this one, it is called that because the atlas sits on top of the axis. Now, the axis is unique because it has a process that sticks out called the Dens process, also known as the Ottonoid process. The atlas sits around the Dens and has connective tissue that wraps around it, and this allows for the Dens to then be a pivot point for that of the atlas. And so this allows the head to then, which is attached by the occipital condyles onto the top of the atlas, to then pivot in a no movement. Okay. So again, this is the axis. And you can see again that they have, again, the transverse foramen, which is unique to cervical vertebrae. Now, many vertebrae will have a singular process sticking out, a singular spinous process sticking out. But some of the cervical vertebrae will actually have more than one spinous process sticking out. And this is called a bifid spinous process. So you can see that there's actually two ends sticking out. So it's basically forked, or forming as a dual separation, so a bifid formation. So that's again a bifid spinous process. Then you can see here that there's a connection point between the transverse process and that of the spinous process here, and you can see that that would be the lamina, which is here, and then you can see that there's a connection point between the transverse process here and of course the body, which is here, and that would be the pedicle right there. Then we have the superior articulating process here and the inferior articulating process here. And that is it.